1 is between the tip of the coccyx and the anus.
Do 2 is located on the posterior midline in the sacral coccygeal hiatus. To find this point, palpate down the sacrum, feeling for the cleft in between the sacrum and the coccyx. In this case, it's quite high. In some cases, you'll find this cleft will actually be inside the gluteal fold.
Do 3 is on the posterior midline, below the spinous process of L4. Do 4 is on the posterior midline, below the spinous process of L2. Do 5 is on the posterior midline, below the spinous process of L1. Do 6 is on the posterior midline, below the spinous process of T11. Do 7 is on the posterior midline, below the spinous process of T10. Do 8 is on the posterior midline, below the spinous process of T9. Do 9 is on the posterior midline, below the spinous process of T7. Do 10 is on the posterior midline, below the spinous process of T6. Do 11 is on the posterior midline, below the spinous process of T5. Do 12 is on the posterior midline, below the spinous process of T3. Do 13 is on the posterior midline, below the spinous process of T1. Do 14 is on the posterior midline, below the spinous process of C7 in a depression.
Do 15 is located half a cun inferior to Do 16. It's on the posterior midline, about halfway between Do 16 and the posterior hairline. Be sure to mark this point directly on the posterior midline. Do 16 is located on the posterior midline at the base of the occiput. To find the base of the occiput, palpate down to about 1 cun superior to the posterior hairline. If you rock the head backwards and forwards very gently, you should be able to feel the cleft between the base of the occiput and the spine. Make sure you mark this point directly on the posterior midline. Do 17 is on the posterior midline. It's 1/4 of the distance between Do 16 and Do 20. Do 17 is 1.5 cun superior to Do 16, but more importantly, it's in a nice depression at the superior border of the external occipital protuberance. Do 18 is on the posterior midline, halfway between Do 20 and Do 16. Do 19 is on the posterior midline, 1.5 sun posterior to do 20, which places it at the junction of the upper quarter and lower 3/4 of the line joining do 16 to do 20. Do 20 is located in relation to the midpoint between the glabella and the occiput. Place the heel of your palm on the glabella and the occiput. Fold your fingers around the skull to find the midpoint. Do 20 is located 1 sun posterior to that midpoint. It typically lies in a nice dip. There are several other nice dips slightly further back, which are other dew points, so don't be tempted to go further back than 1 sun posterior to that midpoint. Do 21 is located on the midline, 3.5 sun posterior to the anterior hairline and 1.5 sun anterior to do 20. 1, 2, 3, 4, 5 sun for do 20. 1, 2, 3 and a half for do 21. Do 22 is located on the midline, 2 sun posterior to the anterior hairline. Use the 3 sun from the centre of the glabella to the anterior hairline to calculate the 2 sun that you need to find do 22. Do 23 is located on the anterior midline, 1 sun posterior to the anterior hairline. We take the distance between the centre of the glabella and the anterior hairline as being 3 sun, so divide this into 3 to get your 1 sun to move back to locate do 23. Do 24 is located on the anterior midline, midway between do 23 and the anterior hairline. Do 25 is on the anterior midline at the very tip of the nose. Do 26 is on the anterior midline at the junction of the upper third and lower 2/3 of the philtrum. Do 27 is on the anterior midline at the junction of the philtrum and the upper margin of the lip. Do 28 is located inside the mouth at the upper frenulum, at the junction of the upper gums and the lip.